Good evening, everyone. My name is Dr. Parth Goyal, and I'm a consultant psychiatrist at Parth Hospital Ahmedabad. Continuing our video series, today I would like to talk to you about newer treatment options for major depressive disorder or depression. The most recent addition to the treatment in major depressive disorder or depression is that of repetitive transcranial magnetic stimulation, also known as rTMS. rTMS is a non-invasive form of treatment. That means nothing is injected into the body while giving rTMS. rTMS utilizes magnetic energy to cause changes in the way the brain functions and thereby helps in reducing depression. rTMS is very different from ECT, that stands for electroconvulsive therapy. rTMS is a painless procedure. In rTMS, no anesthesia is required. rTMS is a very focal or a targeted form of stimulation as compared to ECT. rTMS is not associated with any memory losses or any lapses in memory, and rTMS can also be used in patients who have other medical comorbidities, for example cardiac illnesses or morbid obesity, and in certain special conditions, for example pregnant females who are suffering from severe depression. The most frequently asked question to us is, what is the indication for rTMS? rTMS was approved by the Food and Drug Administration of the United States of America in 2007 for treatment of resistant depression. Resistant depression means that kind of depression which does not respond to conventional medication, that is antidepressant medication. rTMS since then has also been approved for the treatment of obsessive compulsive disorder and for treatment of certain substance use disorders such as smoking cessation or nicotine use disorder, and has some application in alcohol use disorder or alcoholism. Question 2. When should ECT be considered instead of rTMS? Please note that ECT is the gold standard of treatment in psychiatry. If the patient is having active suicidal thoughts or ideas or has had a recent attempt to end his life, ECT should be considered instead of rTMS. Also, if the patient has complicated depression, that is depression with psychotic features, or catatonic depression, then also ECT has to be considered and not rTMS. Question 3. How does rTMS work? rTMS works in a very targeted manner. As compared to other brain stimulation therapies, rTMS does not stimulate the entire brain. In rTMS, specific region of the brain which is involved in causing depression is targeted. rTMS utilizes magnetic energy which brings about changes in the way the cells in that particular region function. Thus, by changing the activity of the cells, rTMS promotes the release of newer and more robust neurotransmitters which help in reducing depression. For anybody who has a background in neurosciences, rTMS basically works by altering synaptic plasticity. Repeated use of rTMS in patients with depression induces long-term potentiation, which brings about an increase in the neurotransmitter levels, which thereby reduces depression. So, coming to the next question. If I have depression, what is the treatment protocol for depression? The FDA protocol for patients who are having resistant depression, that is depression not responding to illness, requires them to take 40 sessions of rTMS. At Parth Hospital, we give up to 4 sessions per day. Therefore, the duration of the treatment is 10 days. rTMS is an OPD procedure. It does not require any hospitalization. Each session of rTMS for patients with major depressive disorder lasts for 40 minutes. 2 sessions are given usually in the morning, and an intervening gap of 3 hours is kept, and 2 sessions are given after 3 hours. A total of maximum 4 sessions can be given in a day. For patients who are not treatment resistant but are not responding adequately well with medicines and require the dose of medicines to be increased, can also consider lower number of sessions of rTMS. Usually we see good and robust improvement with 20 to 30 sessions of rTMS in patients who are not treatment resistant. What are the side effects of rTMS? There are no permanent side effects of rTMS. There are no major side effects of rTMS. The most common side effect of rTMS is heaviness of head, which is usually experienced in the first 2 sessions. This heaviness of head is transient. It does not require any additional medication and it goes away on its own. The rarest of the rare side effect with rTMS is the possibility of a seizure, and the chances of this seizure are 0.01 to 0.1%, which is lower than the risk of seizure associated with that of antidepressant medication. In how much time do we start seeing the effects of rTMS? The effects of rTMS can be seen within the first couple of weeks. Peak effects can take up to 1 to 2 months. How long do the effects of rTMS last? In our clinical opinion, rTMS effects last for years. We have not needed to give booster sessions of rTMS to most of our patients. But however, some patients might require booster sessions of rTMS. Can rTMS be used as a monotherapy? We at Parth Hospital do not recommend the use of rTMS as a monotherapy. In all patients receiving rTMS at our setup, we always advise or encourage the use of at least one antidepressant medicine to continue the effects of rTMS post the completion of the rTMS course. I hope this video has been helpful to you in understanding what rTMS is, in which conditions it is useful, and how it is given at our hospital. For more information, please visit our website www.parthhospital.com. If you like the video, please subscribe to it so that it encourages us to make more informational videos for your benefit. Thank you.